Welcome back to the Morning Show here on Arise News. In January, President Muhammadu Buhari rolled out a basic healthcare provision fund generated from 1% of the federal government consolidated revenue and contributions from donor grants to fund the basic health needs of Nigerians. The fund is expected to help revive the health sector, especially primary healthcare centers, many of which have been abandoned across the country. Joining us now to speak on the healthcare industry in Nigeria is former Minister of Health, Professor Onyebuchi Chukwu. Prof, good morning.
Good morning.
Good morning, Prof. Well, should I say Happy New Year? First time I've seen you this year.
Well, happy Easter too.
Well, you are welcome to the Morning Show. Good to have you here. The healthcare system in Nigeria has been in the news recently, with reports in the newspapers about the poor state of our teaching hospitals, the disappearance of primary healthcare centers, and, in some cases, hospitals don't even have bed spaces. There have even been reports of security challenges, armed robbers attacking hospitals. And then recently, there was also the Minister of Labor and Productivity, in fact, 2 days ago, on Wednesday, saying that we have more than enough doctors in Nigeria and brain drain is not a problem. Any doctor can go abroad, make money, and repatriate funds back home. And he's been taking on this issue. What really is the most serious problem in the healthcare system in Nigeria that we really can't get it right? Is it financing, despite the fact that there is this 1% charge on the consolidated fund? Or is it really manpower?
I think the major problem is that our healthcare system in Nigeria is fragmented because of our so-called federal system. To start with, we have a problem with the Constitution of the Federal Republic of Nigeria, 1999, even as amended. Health does not appear on any of the legislative lists. So it's actually a presumption based on what we had in the 1979 Constitution that health is on the concurrent list. But it's just purely a presumption, because if you check your Constitution today, health is not mentioned anywhere. So that even shows how serious we are about health in this country. Now, what I mean by the fragmentation is that with the presumption that health is on the concurrent list, it means the responsibility is actually shared between the federal government, state government, and even local governments. And while every blame actually goes to the federal government most often, I think wrongly too, much of the job ought to be done at the state level, but it's not a priority. Health apparently is not a priority for most of the state governments. If you go around today, the concentration of doctors are in the federal medical centers, federal teaching hospitals. Many states don't even employ doctors. They depend entirely on the federal hospitals. Now, these federal hospitals were purely tertiary institutions. So if you must lay blame on President Buhari, for instance, you must lay blame on him for what is not happening in about 70 hospitals or so. Whereas, we have thousands of hospitals in Nigeria. Among the public ones, many of them are actually owned by the state governments, some by local government, and of course the private sector. So the number one problem is actually the fragmentation. So that is, we need to have a system. But that is what the National Health Act came to address. The National Health Act is a major achievement on the part of Nigeria, and kudos to the minister who initiated it, Professor Yitayo Lambo. But it took me to be the one under my watch to get it promulgated, and of course, the former president got it signed. But the present president did something out of the National Health Act. He started implementing it. You talked about the Basic Healthcare Provision Fund. Yes, this was done under the watch of President Buhari, under the President Minister of Health, Professor Isaac Adewale. So it's been a continuity in terms of getting it right. So we're just beginning to get things right in Nigeria. So that's the point I want to make. Of course, people will always talk about funding, but I think first we need to have a system, and then funding, And then managerial capabilities. There's a lot of waste. Efficiency is not there because truly health is underfunded in Nigeria. But even at that, we could still do a lot more with what is being provided.
But are we truly getting it right? I mean, it is impossible to forget the responsiveness, the dedication, and the sacrifices of one and all, you know, to quickly nip in the bud the Ebola crisis in 2014 when you were a minister. However, since then, it's been a spiral downward in, I mean, tackling disease outbreaks in the country. Few examples: Lassa fever, cholera, meningitis, yellow fever, just to mention a few. So are we really getting it right? Why did we go from being able to tackle Ebola so quickly to what we have now?
Well, I think we're getting it right now. You've forgotten there was a little law from the time the last administration left office on the 29th of May, 2015, to when the ministers were appointed. The truth, if be told, is that if you must have anything implemented, you need ministers. Ministers are important because they are the only ones that their jobs are always being threatened. Civil servants are somewhat protected. It's difficult to even sack the lowest cadre of civil servants. Very difficult. They are well protected by our provisions in our laws and our general regulations. So it is the minister who knows that he or she is actually holding that office purely at the pleasure of Mr. President. Mr. President can wake up on the wrong side and you are gone as a minister. So they are the ones that feel they have something to account for. They need to show Nigerians and their boss that they could do it. So I think that may have been responsible. That is my theory, that may have been responsible for some of the lapses we started experiencing. But once the new people got on, I think we started doing well. If you go through the operational manual of the Basic Health Care Provision Fund, you'll be proud to be a Nigerian. I just hope now that the systems that have been put in place for accountability will need to ensure that people do not fritter these funds. The funds are not much. Of course, the law says at least 1%, which means between Mr. President and the National Assembly, they are at liberty to even increase it to 5%. And I'm advocating that it should be increased to 2% even by next year. But let's start with this 1% they've provided as additional funding, public funding for healthcare. Now, the beauty about it is that through the instrumentation of the National Health Act, without breaching our constitution and still allowing the states to be in charge of their healthcare delivery system, we've offered carrot. For instance, if the states must access this special fund, they need to establish two things. One is the State Primary Healthcare Board or State Primary Healthcare Agency. The second one is the State Health Insurance Agency. So in a way, we started getting states to establish this. These agencies were not there in most of the states 5 years ago. Only very few states 5 years ago had established their state primary healthcare boards, and only 1 or 2 or 3 had their own health insurance agency. But because everybody wants to access funds, this has forced quite a number of states now to have these 2 key agencies established at the state level. Now, this is a beginning. I think our people, even the media, I'm now happy that the media now is screaming about healthcare. We should make healthcare even a campaign, political campaign agenda item. Nigeria is one of the countries where health, nobody talks about health during elections. In other places, particularly the advanced countries, someone can get elected or not elected as president just because people are not happy the way he's projecting healthcare delivery. So gradually now, we're beginning to realize that there are things beyond the mundane aspects of life. Health is very important. So I think we are on the right track. Of course, there are teething problems. We must accept there are teething problems. People are going to understand the system gradually. But more importantly, I think commitment on the part of everyone. Mr. President is showing now commitment on universal health coverage. About a week or so ago, I was invited by the National Institute of Policy and Strategic Study, KURU, to come deliver a lecture to the current senior executive course. And I was pleasantly surprised when I read the letter and found that the theme for this present course, 41, is universal health care. And of course, you know that the theme must be approved and given to that institute by Mr. President. So if Mr. President himself approved and gave that institute to look at strategies for delivering universal health care in Nigeria, I think the commitment is coming in.
Prof, still on this crisis in the health sector, you also gave a lecture recently where you talked about politics and health and the implications of the nexus to the Nigerian citizen. Where does the nexus lie? How do you explain the nexus? And how much damage has politics done to the healthcare sector in Nigeria? Did you hear me?
Sorry, can I didn't quite get.
No, I was saying recently you gave a lecture where you talked about politics and health, implications of the nexus to the Nigerian citizen. And earlier on this program, you've talked about fragmentation.
I wasn't the lecturer. I was the chairman on the occasion.
Okay.
The lecturer was actually the immediate past chief medical director of the Lagos University Hospital, Professor Akin Ochibogo. But I was the chairman on that occasion, yes.
Yeah, but I'm now asking you, yes.
Politics affects health in every country, there's no doubt. Just like any sector, there are always political considerations. Now, one way politics has impacted negatively in Nigeria is that because supposedly the majority of the real electorate, when I say the real electorate, not the electorate on social media, these are just the minority, real minority, and many of them on social media don't even have their voters' cards, I can tell you. And even when they do have voter cards, they don't even go to vote on the day of election. They just sit analyzing what the voters are doing. But the real electorate are largely uninformed. They are impoverished, which means if they can easily sell their vote, and they sold their votes a lot in the last general election. And so because we have such electorate that is not so well informed, that is ready to sell their birthright, what has happened is that when you get elected as a governor, you are not thinking of what the people need. You are thinking of what you use to show off for your next election if you are going to have a second term. And so what people are more impressed, even the media is impressed when a governor goes to cut the red tape to open a new building without personnel, and they call it a clinic or a hospital, without nobody asking how water supply will be made there, how electricity supply will get to the center. But truly, if any governor can provide basic health care covered by health insurance to his or her people, that governor has done exceedingly so well. But of course, these are abstract things. When people are now asking you to show them your achievement, it's difficult to show them a building, something tangible they can see and feel. But in societies that are developed, things that mean more are not necessarily that tangible. Good health, good education, potable water, security. These are things that actually make for a good society. And these are things where this should be the primary concern of our president, the primary concern of our governors and local government chairmen. So politics do impact. Then, of course, where people cite facilities are also influenced by politics. People will go and cite a hospital where you don't have the population, and then expect the population to begin to arrange for transportation. Meanwhile, there's no road to that village, and there's no proper transport system there. So even if when a pregnant woman suddenly goes into labor, he needs to travel long distance to get skilled help. So politics also influences. Then politics affects it in terms of what we consider priority even in the health sector. The outspoken minority in Nigeria, of course, suffer a lot from non-communicable diseases, where every life is very important, but we must prioritize lives. We must do good to the largest number. If diarrhea is a bigger problem, we must conquer diarrhea generally because more people will suffer from it, more people will suffer from malaria. And of course, not neglecting the more complicated cases, but where we place so much premium on treating very few people to the detriment of majority, that has been that's actually part of the political negative impact of politics on the health sector in Nigeria. Then, of course, even how we release funds, I think we need to overhaul our budget system. I think clearly the National Assembly needs also to listen to Mr. President. Mr. President has been elected by Nigerians to be the chief executive. But the National Assembly has been elected by Nigerians to be the watchdog and to also monitor what the president does and also convey to Mr. President some of the peculiar needs of their constituents. So the National Assembly and the presidency will need to work together at the beginning of each budget cycle, agree on what should be the priority for governance for the coming year. And once they've agreed, the budget should be tilted towards those priorities. My experience when I was minister wasn't too good in terms of budgeting. What happened was that we're basically recycling ideas that have been there even before I became minister. And everybody wants to control fund. So if budget has been given to a particular sector, that sector never wants it, touched. Whereas the truth is that priorities will continue to change. For instance, now security is a big problem in Nigeria. Unemployment is a big problem in Nigeria. Education is a big problem in Nigeria. Healthcare is a big problem in Nigeria. Therefore, those three or those four ought to take greater priority in allocation of scarce resources in Nigeria today. But that's not the issue. So these are some of the negative ways politics have been impacting on the health sector.
Indeed. Well, you've talked about funding, you've talked about commitment, and of course, the role politics play. But let's talk a bit more about leadership. African leaders, including President Muhammadu Buhari, have been accused of lacking faith in their healthcare systems by seeking foreign medical treatment. I mean, it's not just the president as well. It goes beyond that. Some public office holders are said to even use public funds to seek those medical trips abroad. And this is not unfamiliar with you, because in 2012, you revealed that there was a memo you were trying to introduce to the Federal Executive Council to stop public officials from seeking foreign trips, medical trips. Whatever happened to that memo?
It wasn't eventually a memo. Initially, I thought it would be to need to go to the Federal Executive Council. But after I spoke to my boss, President Goodluck Jonathan, about what I thought about how public officers ought to be handled when it comes to referrals abroad for medical treatment, he listened to me and invited the head of civil service of the Federation. The then head of civil service of the Federation now had a meeting in which I was present with Mr. President. Mr. President was saying, do we need to change laws in Nigeria such that the Honorable Minister of Health, who are often appointed from the medical profession, will have the last say as to whether we should use public funds to sponsor public officers abroad for medical treatment. And the head of civil service of the Federation says to Mr. President, no, you don't need a law. It's entirely within your purview, sir, because it's just a provision of the public service rules, the PSR, and the PSR is clearly under use as Mr. President. So he now said, what will it take? Say he will make a memo, Mr. President will endorse it, and he will communicate same to the Honorable Minister of Health. So it did happen under President Jonathan that a memo was prepared by the head of civil service, endorsed by Mr. President, and the head of civil service of the Federation communicated me as Minister of Health, saying now, instead of the permanent secretary in the ministry being the one to convey to me, recommendation for us to sponsor a public servant abroad for medical treatment, it is you now, Honorable Minister. And while I was minister, we actually started using it. Of course, I made enemies out of it. One that I particularly remembered is a very high-ranking lady who had cataract and was referred to the medical board in the Federal Ministry of Health. And after evaluation by the medical board, the recommendation was that certainly she has cataract, cataract in both eyes, and that she needed to have it operated on. But since cataract, any kind of cataract operation can be done in Nigeria. We have good hospitals, even in the private sector. Now, one good thing about that was that we're not limiting referrals to public sector. In fact, if you prefer to go to a private hospital in Nigeria, the federal government will still pay for you. So there were quite a number of people who were paid for, and they went to the private hospital and got well treated. So I now asked them to write the person concerned, telling her that we've evaluated her, and the federal government will pay for her treatment. Could she pick from the list of the following hospitals? So we gave her 3 hospitals that could perform any kind of cataract operation in Nigeria to pick from. And then she raised hell. Of course, she had the right to use her own funds, of course, to travel abroad. That is fundamental human right for any human being. You can choose your doctor anywhere in any corner of the world. You can spend your own money. But when it comes to spending public money, you may not have 100% rights. So it was operational. It's an extant memo. I guess it's still extant, and I believe they may be using it. I don't know, but it's extant. I'm not sure anybody. I don't think the present head of Civil Service of Federation or any other head of Civil Service of Federation had withdrawn it. That would be unfortunate if anybody withdraws that directive. So I think it's still extant.
Well, Professor Chukwu, let me take you back to an issue I indicated much earlier, but which you didn't get around to. This issue about manpower, doctors, whether we have enough doctors in Nigeria or not, and whether indeed it makes sense for the Minister of Labor to advise that, look, doctors can go abroad and seek greener pastures elsewhere. We have more than enough doctors in Nigeria.
Well, everybody has his opinion, which is informed by whatever knowledge that is at your disposal and probably by the experience you have. But my own opinion is clear, and I think that's the opinion of majority of Nigerians. Certainly, we are not near having the number of doctors we should have in this country. We don't have enough doctors. We need to have at least about 300,000 doctors practicing in Nigeria for us to claim to have adequate number. Then we can begin to look at the distribution, because one thing is to have the absolute number required. The second is to have the right distribution of doctors. Certainly we don't have. And it's a pathetic situation that while we don't even have enough doctors, WHO recommends 1 doctor to serve 600 citizens or residents. In Nigeria, presently, even if we were to distribute the doctors we have in a more equitable manner, it's about 1 doctor to 5,000 citizens or residents. So it's a far cry. 5,600 are not near at all. They are not proximate. So it's unfortunate for anyone really to think that we have surplus physicians in Nigeria. And now there's this flight, human resources flight, which is purely economic. As you know, especially since we depend a lot on foreign things, the value of our currency is tied to the dollar. And as long as the value keeps falling, the actual value of your salary keeps falling. And doctors, like every other citizen, they have responsibilities to their family, to themselves, and to society. And so a lot of doctors are finding it difficult even surviving. They can't maintain their vehicles. And so just like any economic hardship facing any Nigerian, and you know, it's not only doctors that are migrating. Virtually everyone that wants to have a way of migrating is migrating from Nigeria. But it is worse when skilled personnel who have been trained partly from the country's resources, because whether we like it or not, medical education in Nigeria is largely subsidized by governments, except in private universities. So if we must spend part of our public funds subsidizing education in Nigeria, Nigeria should benefit from such investment, but it's really unfortunate. So to answer your question, we don't have enough doctors. We're not even near having enough physicians in Nigeria. Brain drain is unfortunate. It's purely economic. In the case of doctors, largely economic, and then it's unfortunate that this is further reducing the number of doctors. And of course, the distribution is skewed towards the major urban centers. toward the bigger hospitals. There are places in Nigeria today they've never seen even a qualified nurse, let alone a qualified doctor. And that is the reality. There are places in Nigeria that I've never seen a laboratory scientist, let alone having other cadres like a pharmacist. So we have problems in this country.
You were Minister of Health at a very interesting time in the history of Nigeria. And I know you are planning to write a book on your experience. You said that in one interview. But would you like to share with us what you consider to be your most memorable moment as Minister of Health of Nigeria, or perhaps your most difficult moment?
Well, the most memorable happens now to be the same as the most difficult. In a way, the unfortunate Ebola virus disease outbreak actually now is what people associate my ministerial tour with, and I don't blame them. It was the most dramatic. You know, it's like in hospital practice, the most dramatic is operations, surgical operations. Even the media is more enthralled with surgical operations than other things. But I can tell you, other cadres of specialists are doing other wonderful things. And sometimes, in my opinion, even more wonderful things than we surgeons. I'm a surgeon, I'm an orthopedic surgeon. But of course, what is more dramatic is a surgical operation. So in the same way, being able to nick in the bud, as it were, before it spread beyond the number of people, casualties we had, which was quite unfortunate. I would wished that no single Nigerian died in Nigeria from Ebola virus disease, but even the number that we had that had to pass on was so unfortunate. 8 people dying on our watch. It wasn't something one would celebrate, but it wasn't anything near what happened in other parts of West Africa during that epidemic. So it was the most difficult period of my tenure because I saw my job on the line. Certainly, if I failed, I would have been sacked. I'm sure Mr. President would have waited for me to fail. My counterpart in Sierra Leone, who I knew personally, lost his job because his boss perceived that he wasn't doing the job. I was lucky to survive it. I didn't sleep during the period. The average number of hours a day I slept was 3 hours. But everything worked out for us. I was committed. God gave me some gifts. One of the gifts God gave me is actually leadership. I would say it. I know I'm gifted in that. I can organize people. But, of course, there were people who actually did the job. The people who were at the battlefront, we paid tribute to all of them. They worked so well. Many of our colleagues, nurses, doctors, laboratory scientists, statisticians, health administrators, and then the state ministries of health, state commissioners for health, the governors, the Mr. President himself, everybody, Nigerians, the media, they worked overtime that time, the private sector, so many of them did marvelously well. So it was the most difficult, but I was just the, captain of the team, and I think we're happy today that we played well, and we scored the necessary goals, and we were triumphant. So it was actually the most difficult of my tenure, but it was also the most memorable.
Well, indeed, we cannot all forget so quickly. But in a way of setting an agenda for President Muhammadu Buhari's next term, for the health sector, what sort of agenda would you like to see?
Well, Mr. President himself has said the agenda. I just told you that he has asked the National Institute of Policy and Strategic Studies focus on universal healthcare. So if he is doing that, I guess he's doing that in preparation for his second term, which means in the health sector, the #1 agenda for Mr. Health, as chosen by him, is universal health coverage. When people ask me, what do you think you didn't quite achieve as minister, I always point to 2 things. Putting a significant stop to outbound medical tourism, and second, not concluding on universal health coverage. But on each of these 2, I started something. Take, for instance, the issue of stopping, well, you can't stop totally because people have a right to go either to Mars or to the moon to have their health care. Even people in Abuja, Some people travel to Lagos to have to see their doctors, and vice versa. People come from Enugu to Abuja to see their doctors, and people move from Abuja to Maiduguri to see their doctors. So that is fundamental human right. But when it becomes disturbing because people feel people are not competent, then that is what we mean by a situation where the government will need to come in. So right now, people leave Nigeria for all sorts of reasons to go and have treatment, and sometimes they are actually not mismanaged abroad, particularly in some foreign countries. But I started something which went through the National Economic Management Team. I had set up a team under Mr. Tony Elumelu. It wasn't purely only medical people. I brought in people, experts, people who were investors, businessmen, health practitioners, doctors, people who are investing in the health sector, people who knew what it took to have a proper health sector, because it's not only doctors that can build a health sector, not only health professionals that can build a health sector, even people in the finance world can also be important because they can tell us how to access credit, and even people who are used to organizing things. So I brought them all together under Mr. Tony. Started working. In fact, people were impressed. If I had stayed longer, we would have started mitigating this issue of external medical tourism, because the idea was eventually to have government provide intervention funds to the private sector, not to necessarily to set up big hospitals, but to set up what I call the small and medium scale enterprise in the health sector, where doctors can even, a consultant who wants to be in private sector doesn't need to do everything. It's not necessary. Identify the gap. Why do people go abroad when they have problems in your specialty? For instance, if it's an orthopedic surgery, one of the areas could be they are going for spine surgery. And so someone can set up a spine center, well-funded, well-equipped spine center. And then the corollary to it is that the person coming to benefit from the spine center, a patient, must be able to pay. Because if that patient cannot pay, then it's a wasted investment. You can't recover the investment. And that is where universal healthcare comes in. Because with universal healthcare, you must ensure that there's no catastrophic payment system for the patient. Right now, Nigerians spend out of pocket. And I can tell you, it is then you know that virtually everybody in Nigeria is poor. Virtually everybody. It is then you now know that less than 0.5% of Nigerians are rich. When you know you are poor is when your doctor says, well, part of, just to confirm my clinical impression, you have to do this investigation, you have to do this investigation, you have to do, and all of them come to about maybe 300,000 just for the doctor to narrow his diagnosis. And how many people have been earning up to 50,000 a month in Nigeria? How many? How many people are saving for health when, you know? So those are two things that I started. I was the one that got Mr. President to accept to host the Presidential Summit on Universal Health Coverage. And
Prof,
that was the beginning. And also, I was also under my watch, the National Health Act was also...
yeah, that was in 2014, and then the National Assembly passed it again in 2018. And it's good you brought up the issue about the National Health Insurance Scheme, which is also one of the things in the National Healthcare Development Strategy Plan 2018 to 2022 that has been put in place by President Buhari. But let me ask you a final question on a personal note. In 2015, you tried to run for office as governor of your home state of Ebonyi. But in 2019, I didn't see you on the field. What happened? You know, what was your experience in 2015? Did the opposition scare you so much you decided to step back from partisan politics? And are you likely to run again? Change your mind, perhaps.
No, I'm not step back from partisan politics. I'm a card-carrying member of the All Progressive Congress. I left PDP in February 2016, and on 17th February 2016, I joined the APC at my ward. And I guess today I'm one of the prominent faces of APC in Ebonyi State. So I've not left politics. However, politics is not a profession to me. I know I've always argued with some of my colleagues then when I was minister as to whether politics was a profession. For those that politics is a profession, that's the only thing they do. I have two professions. One, I'm a medical doctor. Two, I'm a teacher. And that's why people say professor. I'm an active professor currently, and I practice orthopedic surgery currently. I operate on patients currently. But I'm also a politician. So for me, politics is a vocation. I decided to take to politics as an avenue of service. So it's not really a matter of life and death. So what happened is that the circumstances, I was interested in running for the governorship position in the Ebonyi State in 2019. But during the processes leading to the primary, I found that it wasn't going to happen, and I'm a realistic person.
Thank you, Professor Chukwu. We hope that in 2023 you will try again. We hope that maybe in 2023 you will try again and you'll be able to go beyond the primaries.
Not everybody must hold a position. When you're not a candidate, you must also participate in ensuring that candidates in your party win, and that was a great role I played. I tried to ensure that votes
went to my party.
We didn't win in Ebonyi State, but we made effort. Yeah.
Thank you. Thank you, Professor Chukwu, for your time and for the insights you've been able to share on, to share with us.